Long block is unlike anything else I encountered when I was in the interviewing process.
Our program is structured very differently from many places that are X plus Y or a traditional model where you just have a half day of clinic every week.
The story of the long block really begins with righting some of the wrongs that happen to people when they fall into a safety net. In the old days, our practice was chaotic, with residents constantly coming and going, tied to inpatient schedules, and the care we were delivering, frankly, wasn't very good. And so we tried to reimagine how we were doing things. We thought the secret sauce was improving continuity between patient and doctor. We went to the drawing board and we came up with several models, one of which we called the short block model, which was become the X plus Y or the 4+2 model, but we rejected that idea because patients in our environment don't just get sick when we're present. They need something that we call burst continuity, which is the ability to stand and deliver over a long period of time. So patients with chronic disease don't have to keep explaining themselves to a new doctor every time. And so we developed the long block. 1 year of true continuity, 1 year of doing what doctors actually do in the ambulatory setting.
Long block is 1 solid year where you really get to have a lot of continuity of care, where the patients truly think of you as your primary care doctor.
So it gives you a more realistic experience for what it's like to be a primary care physician. By doing this, we don't have to split up our time between being in the hospital and, oh, by the way, I have clinic 1/2 day a week, or I'm in the hospital for 4 weeks, out of the hospital for 2 weeks, because no one practices like that in the real world.
It takes primary care seriously. It says that primary care is so important that it's worth not just throwing into 1/2 day a week or 1 week out of the month. It's worth doing at an intense enough level that you A, can take really good care of your patients, and B, you can improve in taking care of your patients from 1 day to the next, 1 week to the next.
You inherit a panel of about 150 patients who then call you their primary care doctor, and you follow those patients for a whole year.
You have 3 half days a week where you're in clinic and you're these people's doctor, and you help manage everything that's going on with them.
You have 3 half days, and typically that rotates different half days, so you really get the same patients. You get a lot of continuity of care.
You start to get to know them, and then a couple months in, they really start to be like, yeah, you're my doctor, you know me, I really appreciate your help.
And it's all stuff that is really, really hard to do by yourself in a normal residency program, where you're in clinic 1/2 day a week, and you never really know who you're going to see or whose patients they actually are, or who's going to cover those people, when you're not around. There's a lot of continuity that is really, really cool to experience.
Because the patients know you, because they are able to relate to you, because of the relationship you built with them, it's easier for them to trust you. And when the patient trusts you, it's easier for them to kind of form a team with you to be able to help solve their problems for them. So that's one thing that I think Long Block is different from any other model that you see across the country.
I've just seen multiple people, whether it's diabetes or hypertension, they improve so much over the course of the year, which I don't think you always get a good view of. And a lot of it's directly from the changes that we're making in clinic, and not just that I'm making, but that we're making together as a team.
We focus on building relationships, which become your greatest therapeutic tool. And remember that relationships aren't just the time you're with people, but also the time in between when they call you and they think of you as their doctor.
You really have to manage them, in the office, but more importantly, outside of the office, because a lot of patient care happens outside of the office when you're a primary care doctor.
You are the patient's primary care physician. They call you when they need scripts. They call you when they have other problems or need help.
In residency, you always have supervisors, you always have your senior resident or your attending who kind of is the one in charge. But the first time I felt like I was a true doctor, taking care of my own patients, was when I hit Long Block and patients would ask you stuff on the phone, and you would have to answer them, and you didn't have you have backup that you can ask later, but in the moment you're the only one with the patient.
When things happen to the patients, they're looking to you to provide an answer.
What that provides is you truly have the experience of being a primary care doctor for someone.
A lot of our patients have a lot of chronic medical conditions and have a lot of socioeconomic barriers that they have to overcome to take care of themselves.
My eyes have been opened to the barriers that our patients face on a daily basis.
Our patient panels are patients that are often unable to find care in other places throughout the city. So many of them have a lot of trouble accessing healthcare and have a lot of barriers that have been put in place that we really try to overcome and make easier for them.
Some of the patients are people who have had so much loss and trauma and other things go on in their life that you're not just managing their blood pressure or their diabetes.
A wide diversity of patients. I believe the most recent tally is that there are 53 languages spoken among the patients that we serve, which is really cool.
We're seeing all sorts of people. I know people who are recovering from addiction, little old men, little old ladies who are, just trying to get by and stay as healthy as they can. People who are going through really hard, tough times, and people who are really healthy.
A lot of them have had encounters with the healthcare system that they would not describe as positive, and validating that and trying to bring them into a more positive space where they can try to get healthier and pursue a long and healthy life, I think has been a big thing that I've tried to do this year.
I think for me, one of the most rewarding things in terms of Long Block, I would say the majority of our patients are Black, and seeing how they react when they get a Black physician for the first time has been something that's been super rewarding for me. And I've had some patients say having me as their physician has been a great experience because they get to have a physician that looks like them.
I had a patient call me today and say, I'm so glad I'm talking to you. My hip has been killing me. Can we talk about what to do? And I titrated some of his medications for pain. I said we should get you into orthopedics, but he just kept saying oh, I'm just so glad I get to talk to you. You make me feel better already.
One of my coolest experiences, I have a patient that I see now. Really, I could probably see him every 3 to 6 months, but he likes to see me every month. He had some depression issues, and we got him on the right medications, and I got to follow him and follow his status during his improvement time, and now he's doing his old hobbies and really loves life again.
You know them beyond their most recent cholesterol and their most recent blood pressure, that you get to figure out who they are as a person.
Probably one of the biggest lessons I've learned is that if you don't get to know your patient, they're not gonna trust you as much, and each time you see them, you're going to be at a bit of a standstill. So taking that extra time to get to know them, building rapport over time, builds up trust, and then they're willing to try out a new blood pressure med that you think is going to make their life a little bit better and overall care better.
I think the most important lesson is how to listen to your patients, how to listen to people in general. Sometimes people are not coming looking for an answer, they just are looking to be heard. And I've spent a lot of time just listening and absorbing what they have to say.
Our priorities as physicians are not always our patients' priorities. Now that doesn't mean that we negate our priorities or negate our patients' priorities and only focus on one or the other. Long block and outpatient care is really all about a give and take relationship, a shared decision making between us and the patients.
Is this something that they can do and that they want or are willing to do? Because you can give whatever medicines you want, whatever advice you want, but if it's not a team decision, it's not going to happen.
In outpatient clinic, they are asking for your help, and it's a little bit more subtle. And you can't just be on top of them all at once. You really have to put in a lot of trust in the patients and a lot of faith in them. And as well, a lot of patience in the system.
You have to be able to efficiently and effectively see patients in a small amount of time, and you have to be able to work through that visit in a way that makes a difference for the patient.
It really changes how you practice inpatient, truly. When you understand what patients are able to do outside of the hospital, what conditions can be managed, what can be, managed in clinic, and how you can meet the patient where they're at.
Long Block really gives you the experience of what it's like to care for people in an outpatient setting, and it helps teach you what you need to know if you are in a hospital setting. To know what things have to be done in the hospital because it's too hard to do them on the outpatient side versus things that can totally be taken care of on the outpatient side. So it's really important in that transitions from inpatient to outpatient for hospitalist people to know kind of what happens in the outpatient setting.
Because you have the experience of being an intern in an early second year before you then are thrown into the clinic. So you know how the medicines work, you know how the disease processes work, you know how hospitalizations work. Then you get to take all that experience that you learned as an intern and as a second year resident into the clinic with you in the middle of your second year. that means that I think I was way better prepared on my first day of clinic to take care of patients in the primary care setting than I would have been as an early intern.
Once you really get into it, you really start to master and become, like, exceed expectations that you ever thought you could in outpatient care.
The focus of Long Block is really for you to develop your own sense of self as a provider too. You get to do a lot of elective time where you're on various rotations that meet your needs as a learner.
It is a wonderful opportunity for residents to both be the primary care doc for a panel of patients, but also to pursue something that they want to get better at in medicine, whether that be research, education, or something else.
It's a great opportunity for career planning. So whether you are interested in applying to fellowship or want to do a hospitalist or work as a primary care doctor, it's a great opportunity to do electives in those fields that you're interested in.
It has the added benefit of you get basically weekends off for an entire year and mostly elective rotations as well during that year.
If you're interested in doing more inpatient side of things, there's a lot of elective time. So you can spend this time doing consults. A lot of my co-residents who are interested in ICU, for example, they'll use this time to do research. They'll rotate in on the ICUs for like procedure electives.
If you end up practicing in a specialty, a lot of people will need to develop ambulatory skills. So this is a perfect opportunity for you to grow and develop that skill set as a resident.
This program is the only program that I met that had any concept of that, of how much it means to own your primary care patients and really take good care of them.
We've really improved the quality of care that we're delivering. We've won Practice Innovation Awards. We've been a patient-centered medical home for the past decade. We often lead the healthcare system innovation. In fact, one of our former residents developed a sophisticated quality dashboard that's now in use throughout the health system. If you're a resident in this practice, you will know exactly how you're doing because you'll be getting real-time performance data on your patient care.
When I look at my patient panel and I pull up statistics on my patient panel, I can see how am I doing with getting patients referred for lung cancer screening, for PSA checks, for A1Cs. How many of my patients have an A1C greater than 9%? How many of my patients have gotten their DEXA scans that need them? And I know that says at least a good bit or something about how my practice pattern is changing.
My best experience so far is anytime we've gotten a patient's like blood sugar, their A1C comes back and they're super excited because they've been really working on their diet and we don't have to titrate up any medications. If anything, we can take some down.
Working with patients who have A1Cs above 14 and you work with them throughout the year. Every couple of months you meet with them and you test their A1C and you adjust your medications, and all of a sudden towards the end of your Long Block experience you've succeeded in reaching an A1C of 9% or 7%.
We've really built an incredible team to support you in the ambulatory space. It all starts with the nurses and the medical assistants who are working with you on a day-to-day basis. They're just amazing. We have a data management team that helps you move information around and be able to understand what's happening to your patients. We have a pharmacy assistance program that helps patients get their medicines who otherwise couldn't afford them. We've connected with a group called Healthcare Access Now that helps us connect our patients to outside community resources. Because you know that most of what happens to patients isn't what happens to them in the doctor's office, but what happens to them at home. We have an amazing social work group second to none. We have mental health embedded directly in the practice with a depression care manager and a psychiatrist to help us. We've built a food pantry to help those patients who are less fortunate because food is medicine. We've built a social determinants of health curriculum so that everyone can learn what it is that our patients are facing. We have something called the Champions Group, which is a patient advocacy group where the residents learn how to advocate for patients. We have the students doing telehealth. We have group visits and centering visits and all kinds of non-traditional visits that patients can be participating in and you can learn to be part of. And finally, we have the Impact Group, which is the resident-run quality improvement team that tries to improve the care of the patients that we have.
Long Block is like the best year in residency.
My best experience on Long Block so far is the relationships I've built with my patients who require a lot of frequent help.
Emotionally, it's really rewarding and also really sad when things go well or bad in the outpatient. It's almost more impactful in some ways than inpatient because you've gotten to know this person over time.
Long Block has been incredibly meaningful to me on a personal level because it's just dramatically changed the perspective I have on patients. I think you sometimes can go through phases where, especially as a trainee, where you have different perspectives on what patients, can be trusted with, or what are patients like. And my world has just been so expanded to think about how do patients handle their illnesses outside the hospital? How do they manage their life on top of whatever diagnosis we've given them? And I've learned how to trust my patients so much more. And I've learned the ways that I can help them that are so much more basic than knowing the right medicine for them.
The positive feedback you get from Long Block is when you see patients taking control of their own health.
And you get to see the interventions that you make, different medications, different testing. You get to see the results and you get to see what happens.
It's extremely satisfying. Like, it's super, super satisfying. I've given hugs to patients, I've given high fives, they've given me like small presents, they've thanked me. And I honestly think that's the most priceless present that they could give me, is just a thank you.
It's been super rewarding to follow a lot of my patients from November until our last visit in October, and it's been really special to see the changes that I've been able to make as a PCP and the bond that I share with my patients.
I feel like Long Block has been the most rewarding part of residency that I've experienced. It's the time that I've felt the most ownership over the care that my patients receive, and have really kind of grown into that doctor role in a way that I really wasn't expecting, and has been incredibly rewarding.